Hello, this is Dr. Hope, and I'm here with Dr. Grace, and we are at Ask Endocrinologists, a forum where you're able to ask endocrinologists about any questions regarding endocrinology subjects. And we also discuss different topics for you so that we can be better informed because the more you know, the better you are. Today, we will be talking about Cushing Syndrome, Part 1, and Dr. Grace will go over what is Cushing Syndrome and some of the causes of Cushing Syndrome. Dr. Grace?
Thank you, Dr. Hope, and welcome everyone. As Dr. Hope has said, today we'll be talking about Cushing syndrome. Cushing syndrome is not that common like diabetes and other topics that we have discussed, but it is something that also occurred. And we want everyone to be aware so that we can all prevent all these diseases. So, what exactly is Cushing syndrome? It's one of the endocrinology disease that occurs when your body produces too much of cortisol hormone. And what is this cortisol hormone? It's an hormone that is produced by the adrenal gland. In our body, on top of the two kidneys, there are two small glands, and they are called adrenal glands. These adrenal glands produces hormone called cortisol. It produces other hormones as well, like aldosterone and the like. But today we want to focus on one of its production, and it is called cortisol. What exactly does cortisol do? Cortisol hormone is a very good hormone. We all need this hormone during the period of stress. It helps reduces stress level. And one of the what does it do by reducing this stress? It helps control our blood pressure. It helps control our blood sugar. It helps reduces inflammation and helps our body uses the fuel, the energy in an appropriate way. Now, when your body produces too much of this cortisol for a sustained period, long period of time, this leads to what we call the Cushing syndrome. And it could be caused by when you use too much of cortisol for too much long time as an exogenous, like you take it in either for rheumatological problem or autoimmune disease or asthma. This is exogenous. That means you are taking in steroid like prednisone and all the likes. When you use this for too long a time, it can start showing in your body as exogenous too much production of cortisol. And when your body itself produces too much of it, either from the brain, the pituitary gland, when it secretes too much of the hormones from an adenoma or a tumor, pituitary tumor, it can lead to what we call Cushing's disease. Other causes could be when your adrenal gland itself it's producing a tumor, it has caused a tumor called adrenal adenoma. That also can cause too much production of the hormone. Or it could be a very rare cancer form of the adrenal called adrenal carcinoma, or an exogenous from outside the adrenal gland, outside the pituitary gland, and we call this ectopic production of your ACTH, which leads to too much production of cortisol. So, what are the symptoms that you can have that will make you know that, oh, maybe this is Cushing and you need to check it up with your doctor? So, Dr. Hope is going to talk to us about what the symptoms are.
Thank you, Dr. Grace, for introducing what Cushing syndrome actually is. So, those excess hormones, excess cortisol hormones, can lead to weight gain in the trunk part of the central part of our body. So, sometimes the arms and the legs are thinner, but the central part of our body is overweight or obese. Um, we can also have weight gain in the face, which is sometimes called a moon face. We can have thin, frail skin, also a slow wound healing, and stretch marks that are not flesh colored but purple in color. So sometimes when people gain weight, they develop stretch marks, but with Cushing syndrome, the stretch marks are actually purple colored. Um, you can get a lump in the shoulder area or the back area that is an accumulation of fat, which is also a sign of Cushing syndrome. There can be slow wound healing or acne. And in women, there can be increased hair growth on the face and irregular periods. In men, men can experience decreased sex drive or erectile dysfunction or problems with fertility. Additional symptoms include symptoms that involve your mood. So it can lead to depression or difficulty controlling your mood, having mood swings. Um, Also, just having difficulty concentrating or remembering can be part of Cushing syndrome. Additionally, you can get sleeplessness, difficulty with blood pressure, so very high blood pressure. It can lead to infections and skin darkening, also bone loss. And in children, there can be deep, slowed growth in children as well. So these are some of the symptoms of Cushing syndrome. And if you have any of these symptoms, it definitely is a reason to speak to your doctor about being evaluated and tested for Cushing syndrome. Back to you, Grace. Thanks.
Yeah. That was thoroughly mentioned. So, as Dr. Hope has mentioned, if you have any of these symptoms, it is good to visit your doctor and let them be aware. And as you know, sometimes you gaining weight, you've tried everything, and you don't know the reason why you are still gaining this weight. And as we've mentioned today, that cortisol, Cushing syndrome can also be a reason why you are just gaining weight. So these are things that needs to be checked out for you to know. So taking point for today is know that there is something called Cushing syndrome, and Cushing syndrome has its symptoms that can make you gain weight and other symptoms, as Dr. Hope has mentioned. And when you notice that you have these symptoms, visit your doctor. The essence of this video is to enlighten us so we know more and we can live better. So talk to your doctor, let them check you out. Next week, we'll be talking about the diagnosis, how to diagnose this disease, and what are the ways to treat it. So like, share, comment, and if you have any question or concern, let us know. We are here for you. We want to know your thoughts about this as well. So we'll see you next week.
Thank you. Thank you for joining us.
Thank you for joining.